when I think about PV patients and controlling their hematocrit and splenic volume, which is not a problem in many patients with PV, the splenic volume, and that's why the Response 2 trial was done. The other thing that I'm really focusing on is quality of life. And this disease affects their quality of life in so many ways with other symptomatology just related to this myeloproliferative neoplasm. I'd like Jamile to comment on this. What has been your clinical experience with using ruxolitinib? And quite frankly, do you ever switch to ruxolitinib for something other than hematocrit control or splenic volume reduction?
I'm so glad you brought this up, because as I was hearing everyone talk, I'm thinking about the last few patients that I ended up switching to ruxolitinib. And it wasn't because of lack of hematopoietic, or I should say hematologic optimization with cytoreduction that they were on before Hydrea, namely, but it's because they developed a lot of night sweats, they developed pruritus, which was difficult to control, and they weren't able to sleep. I mean, imagine if you have one night after the other not being able to sleep because of pruritus, and that didn't respond to any other measures, you know. So I think that was the impetus for a subset of my patients who had PV to improve their quality of life. And I have to say that my experience mirrors the clinical trial data, in which there was, and Ruben is here, so he can speak to that, because there was at least 50% reduction in half of the patient, or close to half of the patient, had greater to or equal to 50% reduction in their constitutional symptoms. So again, it's very similar to what I have experienced.
So I think this is an important point, because what we're talking about is a little bit outside the label of the drug, where the drug's been approved based on splenic volume reduction and improvement in phlebotomy or hematocrit control. But Ruben, you have been involved in a symptom control study in PV, and what can you tell us about the quality of life of these patients that are on ruxolitinib?
Well, without question, it has been, significantly favorably impacted. Both in aggregate, looking at all the symptoms together, kind of a total symptom score model, but also with individual symptoms. And again, in P. Vera, there are certain specific symptoms that are particularly difficult. Pruritus perhaps being one of the most difficult to live with on a chronic basis, many of whom were really quite refractory, night sweats, spleen-related symptoms, and others. So both very helpful with that kind of a target symptom sort of view in terms of the most problematic symptom in terms of quality of life, as well as in aggregate as well. We presented an analysis, my colleague Robin Sherber, at last year's ASH meeting, showing how centrally important the symptoms were to the MPN patient's quality of life. Now, you can imagine if you are itching 24/7, how disruptive that really is for your quality of life. It can be a very, very difficult thing to live with.